Karen Tamley is a member of the U.S. Federal Access Board, but she's now the president and CEO of Access Living, a community-based center that provides resources and support for people with disabilities in Chicago. She has a lot of experience, both as an individual, but also as a leader running Chicago's mayor's office for people with disabilities. So as a city official, she understood firsthand how her work on accessibility and how her lived experience as a person with a disability would change that city. Let's hear what she has to say. And now we're recording with Karen Tamley. Karen, thank you so much for joining us today. This is really a great opportunity to talk to somebody that's been working in city government. And you were the commissioner for the mayor's office for persons with disabilities in Chicago. And now you're the executive director of one of the most dynamic disability rights and disability justice organizations, Access Living. I think your specific experience looking at and fighting for disability rights and justice gives you a lot of insights, and insights that you can share with the folks that are taking these lessons. They're trying to learn about how to make a bigger social impact. Can you tell us a little bit about your specific challenges you encountered, your feelings or experiences, and some of the stories in advancing disability rights in your work? What kind of emotions came up when you're doing this work?
Currently, I'm the CEO of like you mentioned, Access Living, which is a nonprofit organization. I came into this job very recently in March, but prior to that, I served for over 14 years as the commissioner for the mayor's office for people with disabilities for the city of Chicago, which is a mayoral appointed position where you sit in the mayor's cabinet and you have a department that you run, really with the goal of providing opportunity, accessibility, advancing accessibility across the city. So it really entails working with a lot of different government city departments to break down barriers that exist for people with disabilities. So everything from the built environment, like streets and sidewalks and curb ramps, to transportation.
Tell me a little bit more about some of your biggest milestones. Can I would shift just a little bit towards accessibility specifically? Because a lot of people that are thinking about having an impact with cities have seen the tremendous barriers. What are some of the biggest milestones that you've seen in Chicago in terms of advancing accessibility? I know that you've done a huge project on the metro and the subway system, as well as bringing regulations that require rideshare services like Uber and Lyft to offer wheelchair accessible vehicles. What are some of those milestones that you're proud of and that other cities can learn about and think about and taking Chicago as an example?
Certainly transportation is one of the biggest barriers, and Chicago, like many US cities and countries around the world, are older cities where your infrastructure is old. None of it was built after the ADA, right? So it comes to you in a way that's not accessible. So some of the big projects we worked on is first getting our transit authority, who runs our both over-the-road buses, but also an elevated rail system. And one of the big accessibility challenges has been getting these rail stations accessible to people with mobility disabilities. Many of our stations are over 100 years old. So even though our transit authority had met the requirements of the ADA, which requires them to have their key stations accessible, key stations meaning the transfer stations, where multiple lines come together there's still only about 70% accessibility. And so we worked with the Transit Authority to develop a 20-year plan where we assessed every non-accessible station and develop a prioritized plan for making those stations accessible.
As a person with a disability, Karen, how does that make you feel? What is the message we're trying to get across in terms of the emotional response to what the city is and what the city can be?
For me as a wheelchair user who was, born before the ADA and grew up before the ADA, for me it felt like this tremendous opportunity and privilege to be in a position where I had, the power, I guess we shall say, to really advance disability rights and uphold the promise of the ADA of accessibility. Because I always thought of the work that we were doing as not just about those of us with disabilities now, but all of us in the future who will need accessibility. And so to me, that's what was really, really important. I look now and I really see disability as part of like these conversations around equity, and how when you think about disability coupled with race and other marginalized communities, how important it is for our community to be part of those conversations and those decisions that are being made to make our cities more equitable.
You brought your lived experience to the table, as well as that leadership, that authenticity. That was very powerful, Karen. The fact that you're not just a talking head, but you're a mother, a wheelchair rider, you use public transportation. It's really important for people looking here to make an impact, understand that they can get to know a real person. I wanted to shed light on the contemporary issues of COVID next. Do you think disability has changed with COVID? Or do you think some of your work or the work that needs to be done has changed because of COVID?
I mean, coming from the disability community and experiencing COVID, it's really made me, I think, realize to an even greater extent how interdependent the disability community is and how much we rely on support, and in many cases one-on-one support, to be able to live. And how in many ways, like, it's having us kind of face to face about how fragile we are in some ways. I don't want to overstate that, but I think that there is certainly a lot of anxiety and concern in the disability community about COVID, and not just about how our disabilities could put us in positions where we're more compromised with complications of COVID, but how current inequities that exist in healthcare, in access to healthcare, in how we view disabled lives, make us, even more, I don't know what the word is, but I guess just even more concerned about this pandemic.
One of the things, just to wrap up this insight, and thank you so much for being so open about your lived experience. I think it's often that we really put things into context of how important the work is, because people's lives depend on accessibility, depend on essential services, and for people with disabilities, it's even more important. What would be your call to action in terms of ways that we can make a social impact, especially in the area of accessibility and inclusion in city services? What would you say to somebody that wants to make an impact on inclusion in city services?
Make sure that at whatever tables you're at, whatever conversations you're part of, whatever work you're doing in your community, that you're including disability and accessibility issues. You're asking those questions. Is this accessible? How are people with disabilities included? Where are the authentic voices of people with disabilities in these conversations? Because one of the things I learned working in government is that disability and accessibility issues literally cut across everything the city does. That disability rights are human rights, they're civil rights. It's something that everybody is going to benefit from at some point in our lives, and it cuts across so many different issues in ways that you might not, immediately think about. So making sure that disability issues are part of our everyday conversations and decision making is critical.